most of us are just shocked that it would come to the point where you have to advocate for medical workers to be fully vaccinated. How did it come to this?
Well, I think medical workers reflect the country. And I agree with you. You know, it's pretty shocking that healthcare workers wouldn't be the first in line and every person in healthcare wouldn't get vaccinated. I've been calling for a mandate ever since April 14th, when I wrote an op-ed in the New York Times. I think we need to get all the healthcare workers vaccinated. They should not infect other people, putting them at danger. And unfortunately, because of disinformation, because of access problems, people have just stopped getting vaccinated. And we need to get them over that little barrier they have and get them vaccinated.
So the American Hospital Association is saying that only 9% of hospitals have fully vaccinated personnel is rather frightening. Is there any way for us to know if the hospital we might choose to use or be taken to an emergency has fully vaccinated personnel?
No, there really isn't. I am proud to say that my University of Pennsylvania health system, which is a 5-hospital healthcare system, has mandated that all workers get vaccinated. But this came home to me very vividly, frankly, Lawrence, when my daughter was delivering a baby, and she said, I don't want to question whether that nurse or the person coming in cleaning the floor has been vaccinated. I should just assume that they're vaccinated because they're working in a healthcare setting. And I totally agree with her. And I don't think any of us should have to doubt or question or worry that we might get COVID from a healthcare worker.
Have you personally had any conversations with an unvaccinated healthcare worker, or has your group come up with any reports about what they say about why they're not vaccinated?
Well, I think a lot of it is local, Lawrence. I think a lot depends upon the local dynamics on a floor or the local dynamics in a department of a hospital. And typically what you're hearing over and over is if the leader of that group says they're not for it for whatever reason, political reason, the disinformation they might have gotten, that tends to influence other people around them. A lot of this, like the military, like sports teams, a lot of this is local.
Yeah, but the thing that I think we don't get, who live outside the medical community, is we think of nurses as medical scientists. We think of physicians as medical scientists. We think of everyone working with the medicine in the hospitals as medical scientists. Sure, there are people in maintenance who aren't. There are executives in hospitals who aren't medical scientists. But it's the people who are involved in working with medical science every day, deciding exactly how much of a drop of this particular medicine can this patient take. It's people in that section of it that astound us that they are not vaccinated.
Yeah, look, healthcare is not hermetically sealed from the larger society. And I think that's what you're sort of perplexed by. And it just isn't. The same kind of disinformation that happens in society can happen in medicine. And unfortunately, that has happened extensively on this. You know, vaccines used to be seen as a godsend, saving us from serious illness. I remember when I took my polio sugar cubes in school and the relief parents had. But now we've made vaccination this ideological badge of the in-group and the out-group. And that's really what the source of the problem is. We should not make this key life-saving element a badge of you're a member of our tribe or you're against our tribe. And that's been the most serious problem here, that this is not about keeping people healthy. It's about tribe membership.